I want to tell you how we select the patient. We have our own network of clinics managed by professionals in the field, optometrists and orthoptists, where patients come in. Their job is to select the patient and to understand what their issues are. The patient is then placed on a diagnostic and therapeutic path, and the main specialized tests are performed to understand what condition they are affected by. If the patient wants to be seen by me, an appointment is scheduled for them. Then at that point, I review the tests carried out by my colleagues. If the tests are not complete, we finish performing the missing ones. After that, through a conversation with the patient and an eye examination, we try to understand what their issues are and what the prospects are for resolving them. At this point, the patient has a complete picture of their condition, what their problems are, and what the surgical or therapeutic outlook is. If the solution is surgical or can be performed with a laser, the patient is informed about the available options, the risks, and the benefits. And so informed consent is introduced, which is an essential part of modern medical and surgical practice. I personally explain the informed consent to the patient, highlighting its critical points. After that, I give it to them, and the patient has all the time they need to read it and, if necessary, raise any concerns with me, either by email, by phone, or if needed, through an additional consultation. It is important that the patient is made aware of the risks and benefits of the procedure. Of course, it is necessary to try to explain it in a simple way because our informed consent forms, which are provided by the Italian Ophthalmological Society, are still made up of many pages and many words, and all they do is scare the patient. In reality, we need to try to simplify and explain what the real risks and benefits of the procedure actually are. If the patient agrees to the procedure, then they must sign the consent form, fill it out, and give it to the doctor.